Cinnamon may help type 2 diabetics and prediabetics. Back to naturediabetic.com. You probably have this aromatic spice in your kitchen cabinet. It's popular during fall and fills the air during winter holidays. While we associate this spice with sweets, it's so versatile that cooks add it to chili and lamb. It may help control your blood sugar, but probably not if you're a type 1 diabetic. If you guessed cinnamon, you are correct. Cinnamon is high in antioxidants, which help neutralize harmful free radicals in our bodies. In herbs and spices, clove has the highest antioxidant value, followed by peppermint, allspice, and cinnamon. Types of cinnamon. There are 2 types of cinnamon, with one being more beneficial and safer. Cassia is inexpensive and found in most products containing cinnamon. Use caution when consuming high amounts since it contains coumarin, which can be toxic to the liver. The coumarin in some cinnamon can interact with medications that also affect the liver, like acetaminophen or statins, increasing the risk of liver damage. Ceylon is referred to as true cinnamon. Ceylon is more expensive but contains more antioxidants and lower amounts of coumarin. Cinnamon does not seem to work for type 1 diabetics. A study determined cinnamon's effect on glycemic control in adolescents with type 1 diabetes. 72 type 1 diabetics were treated in an outpatient setting with cinnamon, 1 gram a day, or a placebo for 90 days. There were no significant differences in final A1C or total insulin intake. The study concluded that cinnamon is not effective for improving glycemic control in type 1 diabetes. The study is published in PubMed/National Library of Medicine. Besides lowering blood sugar, cinnamon may also lower cholesterol and triglycerides, fat in the blood. An analysis of 10 studies published in clevelandclinic.org found that daily cinnamon consumption led to a significant decrease in total cholesterol and bad cholesterol. A 2016 study of 25 people in the Journal of Intercultural Ethnopharmacology concluded that cinnamon may provide benefits for those with poorly controlled diabetes. Participants consumed 1 gram of cinnamon for 12 weeks. The result was a 17% reduction in fasting blood sugar levels. A study determined whether cinnamon improves blood glucose and cholesterol levels in people with type 2 diabetes. A total of 60 people with type 2 diabetes were divided randomly into 6 groups. Groups 1, 2, and 3 consumed 1, 3, or 6 grams of cinnamon daily, respectively, and groups 4, 5, and 6 were given placebo capsules. They were given cinnamon for 40 days followed by a 20-day washout period. The results were that after 40 days, all 3 levels of cinnamon reduced the mean fasting serum glucose, 18 to 29%, triglyceride, 23 to 30%, LDL cholesterol, 7 to 27%, and total cholesterol, 12 to 26%, levels. However, there were no significant changes in the placebo groups. Also, changes in HDL cholesterol were not significant. The study concluded that intake of 1, 3, or 6 grams of cinnamon per day reduces serum glucose, triglyceride, LDL cholesterol, and total cholesterol in people with type 2 diabetes. The study suggests that adding cinnamon to the diet of type 2 diabetics will reduce risk factors associated with diabetes and cardiovascular diseases. The study is published in diabetesjournals.org. Cinnamon may aid type 2 diabetics and may even be more beneficial for prediabetics. Research published in the Journal of Endocrine Society revealed daily consumption of cinnamon may help control blood sugar in prediabetics, preventing type 2 diabetes in the future. Out of 54 prediabetic participants, 27 received 3 daily 500 mg doses of cinnamon over the course of 12 weeks, in capsule form. The rest received a placebo. After 12 weeks, people on the placebo had higher fasting blood sugar, but levels of people consuming cinnamon remained stable. Additionally, the group consuming cinnamon had an improved glucose tolerance, the ability to metabolize sugar, but the placebo group did not. Our 12-week study showed beneficial effects of adding cinnamon to the diet on keeping blood sugar levels stable in participants with prediabetes, said the study's corresponding author, Giulio R. Romeo, MD, of Joslin Diabetes Center in Boston. These findings provide the rationale for longer and larger studies to address if cinnamon can reduce the risk of developing type 2 diabetes over time. Emmy Sewell, diabetes educator at the Joslin Diabetes Center in Boston, agrees cinnamon can help prediabetics. For people who already have diabetes, cinnamon is not an alternative to medication. But for people with prediabetes who are interested in using diet to manage their blood sugar, it's one of many strategies worth considering. The evidence is still inconclusive, Sewell notes, but cinnamon is inexpensive, and it tastes good. While studies are conflicting, the best way to determine if cinnamon can lower your blood sugar is what I always advise. Be a diabetic detective. No, this doesn't mean you can eat all the cinnamon buns you want. But there are other tasty ways to add more cinnamon to your diet. Sprinkle it on toast, popcorn, oatmeal, sweet potato, and apples. Go ahead, add a cinnamon stick to your coffee or apple cider. Be cautious that if it works for you, it may cause low blood sugar. Just don't use it as a replacement for your medication. If you want to test if cinnamon will lower your blood sugar, use Ceylon as opposed to cassia. Ceylon has more antioxidants and less coumarin, which is toxic to the liver. Please remember this is not medical advice or intended to replace the advice of your doctor. It is not intended to cure any disease. Please do not self-diagnose. Always check with your healthcare provider before trying new treatments. Also, natural does not mean safe. Many natural remedies have side effects and can interact with medication and supplements. It should be noted that the FDA does not regulate dietary supplements but treats them like foods and not medication. Unlike drug manufacturers, supplement makers do not have to show their products are safe or effective. I ask you to please keep an open mind, be a diabetic detective and do your own research, work with your healthcare team, see what works best for you, and monitor your blood sugars. Learn how to manage your diabetes naturally at backtonatureddiabetic.com.